For more than 40 years, the rule for treating a sprained ankle or a pulled muscle was RICE. Rest, ice, compression, and elevation. But no longer. Recent evidence has proven that strict rest and freezing an injury can actually slow your recovery. Today, physical therapists and sports medicine physicians use a new science-backed framework called Peace and Love. This method focuses on actively supporting your body's natural healing process. Immediately after a muscle or joint injury occurs, your primary goal for the first 3 days is to protect the tissue and manage pain. This is when you practice peace. P is for protect. Restrict movement for the first 1 to 3 days to avoid further damage. However, you should still perform gentle, pain-free movements to prevent the joint or muscle from stiffening up. E is for elevate. If possible, keep the injured area raised higher than your heart. This allows gravity to help drain excess fluid from the injury. A is for avoid anti-inflammatory treatments. This includes ice and medications like ibuprofen. Why? Because inflammation is your body's natural first step in tissue damage repair. C is for compress. Wrap the area snugly with an elastic bandage or compression sleeve. This limits excessive swelling while providing support. E is for educate. Learn about how your body is healing and listen to your body. Active recovery that you contribute to is far better than relying on passive treatments like a brace or waiting for a magic cure. You might have the question whether immediately after your injury you should grab an ice pack or a heating pad. The answer is a matter of timing. While you want to avoid continuous icing, a cold pack is still effective for pain management for the first 2 or 3 days. That's because it narrows blood vessels, limiting the amount of fluid that enters and swells the injured area, and numbing pain signals. Use ice for only 10 to 15 minutes at a time, always wrapped in a towel. Then wait for an hour or 2 before the next time. 2 or 3 days after the injury, once the swelling has gone down, switch to heat. Heat does the exact opposite of ice. It opens up blood vessels, which brings in more blood to deliver oxygen and nutrients to repair tissue. Heat is also your best tool for untying muscle knots, reducing joint stiffness, and easing the pain of chronic conditions like arthritis. Just remember, never apply heat to a fresh, visibly red or hot injury. If an injury is painful, you're probably going to want to reach for an over-the-counter pain reliever. But injury guidelines now recommend that you avoid anti-inflammatory medications like ibuprofen or naproxen for the first 5 to 7 days after an injury. That's because your immune system loads up the injured area with specialized cells to clean up the damaged tissue and start repairs. Anti-inflammatory drugs block this process, slowing down your recovery. A better choice for pain relief is acetaminophen, which reduces pain without blocking the healing inflammation at the site of your injury. But that doesn't mean you should never take anti-inflammatory drugs. They can be helpful for chronic joint pain, like arthritis. Once the first 3 days have passed, your injury is ready for long-term healing. This is where the love comes in. L is for load. As you gradually put more weight or force on the area of the injury, let pain be your guide. Your body strengthens tissues based on the load they are carrying for strength. O is for optimism. Fear and anxiety can slow healing. Stay positive and confident in your body's ability to heal for a quicker recovery. V is for vascularization. That refers to increasing the blood in your blood vessels. Begin cardiovascular activity, like walking or stationary cycling, a few days after the injury, but keep it pain-free. This improves total body circulation, pumping oxygen-rich blood through the injured area to speed healing. E is for exercise. Gradually increasing exercise is the key to long-term recovery, restoring your mobility, strength, and balance, which helps protect you from further injuries. Ultimately, treating an injury at home isn't about freezing the pain away or lying still on the couch. By first protecting the area of injury and then actively rebuilding it, you will be working with your body's built-in repair mechanisms.